Good morning. So our topic this morning is the promise and myth of data, right? And it's fascinating to think about that after that video, right? The beautiful hopes that we have for mobile and all that that's going to do for us. And after the plenary this morning, which offered us a challenge around how much we can know about each other and the gaps between the private sector and the social sector and those communities. And so what we want to do today is have a conversation around how far we've come with data, what we can do with it, and the challenges that we're actually entering all over the place. How do we collect data? What's useful data? How do we make data meaningful? And how can we do more? So what we're going to do over the next hour or so is we're going to have two speakers who are going to come up and present some ideas about how they're using it. And then we're going to turn it over to all of us to have a conversation about what you're learning, what's working, what's not working, what the challenges are, and what some choices we face as we try and move forward on this topic. So I look forward to the conversation. Helene, I'd like you to come up first, if you don't mind, from CARE. Thanks. Helene Gale.
Good morning. And what I'm going to talk about is some of the ways in which we're using data for programs in education in our work around the world. For those of you who don't know, CARE is an organization that focuses on eliminating extreme poverty. In that context, we put a real focus on empowering girls and women because we know that girls and women are both disproportionately impacted by poverty, but are also the ones who in many ways provide a lot of hope for the solutions that are long-lasting beyond what we do for that woman or that girl, but for whole communities. And in that context, education is particularly core and critical to our mission because we know that education can really unlock people's potential in ways that very few other things can do. It keeps young girls from being married early, reduces their risk of poor health outcomes, allows them to provide different futures for their children, et cetera. So for us, this is really a big issue, and one where we're involved in over 48 countries in our work in education. So I want to talk about a commitment that we made through CGI back in 2007, but just to give a little bit of context on our overall approach in this area of education. So we like to think about our work in education in three different levels. So this inside, outside, and after, and that's all in relationship to the classroom, because oftentimes people put their biggest focus just on what happens in the classroom. And we know that education is much broader than just what happens in the classroom. So inside the classroom, we want to make sure that we're focusing not just on do children get a chance to come to school, but once they get to school, are they going to get exposed to a quality education or not? And so a big focus on the work, working with teachers and ministries of education to look at and improving and make sure there's actually quality of education. Outside of the classroom, first and foremost, it's critical that communities and families engage and recognize why it's important, in fact, for their girls to get education. We know that girls are left out of the education process because they often aren't valued. People don't often understand the reason for girls getting educated. And so getting that understanding within the community is important. And then also looking at how do we keep learning outside of the classroom once children leave the classroom, so that we work with parents and youth teachers so that learning can continue. And then finally, after school activities that are not just about learning, but how do you take that education and give people the tools to actually have leadership and develop leadership skills so that girls who are educated don't just stop there, but also learn to be leaders in their homes and their communities using things like sports or civic engagement through Boy Scouts, Girl Scouts, et cetera, to also give those leadership skills. So to our commitment, we made a commitment to really focus on innovation and education for marginalized girls, not only girls who are marginalized in the context of their societies, but girls who are also marginalized in the context of their school and their education. $12 million over 10 years, and with a goal of developing innovative programs to address the underlying causes of marginalization in education. And I put a focus on underlying causes because oftentimes it's very easy to focus on the things that we can count and measure easily, like do girls go to school? But what are really the reasons why even if a girl gets access to education that she may not achieve in the same way? We did this with a particular focus on building sustainable partnerships, but also, to the point of this particular session, building data into these programs from the very beginning so that these programs and the innovations were data-driven and that the solutions really responded to what we knew. We used a couple of these different approaches here in our work on innovation. We did research, looked at what we thought were the key obstacles, and then developed approaches that we thought would address those key obstacles. I won't go through these in a lot of detail because of time, but one was engaging communities. As I said before, the importance of engaging communities. And many of the countries that we worked in had on the books councils, community management councils in Bangladesh that were supposed to be a part of engaging communities, but they weren't working. PTA associations where nobody showed up. So we did a lot of work to make sure that there was a much more participatory approach to education. And in that, building partnerships between governments and the community, because it was so important that communities felt that they were empowered to hold their governments accountable and that governments understood what their responsibilities were. Gender teacher training. We understood clearly that from the work that we did, the research that we did, that clearly boys and girls were treated differently in school. And that even if girls got to school, the expectations for girls may be different. The way they were treated may be very different. And if teachers didn't understand that gender dimension, then the experience for girls was very different. And then we looked at this issue of scholarships for girls, because there's a lot of interest now in whether scholarships or payment for school is actually the impediment, or do you actually get more out of making sure that the community is engaged and focusing on this? So those were some of the ways in which we approached it, and we've got a lot of good research that came out of that showed, as a result of those kinds of approaches, increases in gender sensitivity within the classroom, increases in things like math scores. In India, math scores increased almost 80% as a result of these things, increase in enrollment and access and other things. But I won't go into that. We can talk about that more. In our work in making data part of this from the very beginning and embedding it as part of the beginning, we used a quasi-experimental design, looking at communities in which we were working and actually doing our programs compared with communities that were similar where programs were not going on. And we found that generally there weren't a lot of good indicators developed. And so we developed some of our own indicators. Two of them are mentioned here. One is the Common Indicator Framework, which looked at longitudinal change in educational attainment, quality of teaching, as well as this notion of empowerment. Things that you wouldn't necessarily get if you're just looking at the number of books in a school or who's enrolled at the beginning and who's enrolled at the end. And so a lot of the measures that were used are not the kinds of measures that really get at these kind of underlying issues that we were trying to tackle. And then we developed gendered surveys and tools to get at these really tangible issues that are sometimes difficult to tease out around how girls and boys are treated differently, and by whether applying those and looking at those gendered approaches, do you actually get better outcomes? And as I mentioned, we did. So let me just go to some of the lessons learned. These look simple in some ways, but I think these are some of the big things that we learned and that I think go beyond this, but I think we learn and learn all the time. First of all, embedding research in the context of programs takes time. It's always easier to just implement a program. All of us are really impatient to get programs done and hopefully get results, but if you don't embed this research in it from the very beginning, when you're not able to actually measure what you do and then hopefully replicate and scale it up. So it takes time. Building relationships to do that, also critical. Again, when you go in to develop an educational program or any program, people want the program done. It takes time for community, for teachers, for others to understand why is it so critical to embed the research in the context of that. And then thirdly, that ensuring that the activities are context specific. We know there are lots of general principles that can be applied across the board, but it's when you look at the particular context that we're able to make the difference. I will, since he's standing up, I think I won't go through in any detail, but again, I think one of the big lessons for us was the importance of partnerships, and partnerships at all levels, looking at what it takes for the individual, what it takes to build relationships within the community, and what it takes to look at the structures within which education takes place. And then finally, some of the key takeaways are similar to some of the lessons. Research, data inform and help to refine our work. We would not have done many of the things that we had done had we not looked at what were some of these underlying issues and just looked at the existing work. Partnerships at multiple levels were critical. And being able to create and document this work is going to be so important if we don't want the work to just stop with us, but if we want it to be replicated and use these as models that can go well beyond the areas in which we work, and we have some examples of that. Thank you.
Thank you. Thank you, Elaine. And then just again, there's so much in what she just said, right? How much can we measure, right? It's enough to measure how girls are in, how many of them are in school. And what happens to them? What are the gender dynamics? What are the indicators outside of the classroom? What can we actually measure, right? Not only that, the whole topic of partners, right? How do we share data amongst partners? Proprietary data, right? Lots of topics for us for our conversation. But before we do that, Gabby Zettelmeyer from Hewlett-Packard.
Thank you very much. Good morning. So I always say I think I have the best job in the world because I get to run sustainability and social innovation for HP worldwide. And what that means is that we work with our businesses and the labs on creating solutions in the social space, environmental space, and specifically in health and education. And today I'm going to talk about a commitment that we made a few years ago with Mothers to Mothers, which is a great organization out of South Africa. And we chose them at the time because we thought, again, looking at metrics, they work on the prevention of the transmission of HIV from mothers to babies. And they work in all of sub-Saharan Africa. And this is where 95% of the HIV positive mothers live. So if you work in that space, then you can really get your arms around the problem. So when we got together with them, they told us, how their model works. And what it is that they work with HIV positive women who become mentor mothers to newly infected women. And they work with these newly infected women by really taking a very holistic approach. They go home with them and they deal with the stigma and they deal with their families and the husbands as much as they take care of the medical support to make sure that these women know when they need to come back for treatment, when they need to take medication, when they need to come back with a baby. But everything was very, very paper-based. So these women, sometimes they would sit under a tree, sometimes they would work in a hospital, would write down all of the information, and then they would take their notepads to the local office, and there would be a staffer who would just then basically tally up reports and send them to the country office, and the country office would then tally up all the reports and send them up to headquarters. A lot of good information gets lost, a lot of time gets lost, quality is just going down because everything is paper-based, everything is manual, takes way too long. So we asked volunteers from our South African office to go in, IT designers, and take a look at what is the solution that will really work here. And not only bringing the latest and greatest in technology, what will really work for these women in order to make the whole system holistically come together and work as a solution. And we just established a database so that the data input would happen once. The women would still record it on the paper pads. They would then come in and data would be uploaded and it would be available to anybody anywhere. Then USAID entered the picture and they wanted much more information about the mothers and the babies together, mother-baby tracking. And they wanted more metrics on the efficiency and the effectiveness of the program. So we decided to come up with a commitment together and said we're going to reach 20,000 mothers and babies together and really do a much more in-depth tracking where we take a look at a different front end where we can also use mobile and smart devices, where we bring printing technology, where you can scanning technology, where we then basically correlate the databases that we don't track the mothers separately from the babies. So we started that in 5 sites and did a 3-month project there, and then added another 26 sites, and we're still refining the findings, but certainly we have become much, much more efficient, effective, have the information on the tip of our hands. So when I take a look at some of the lessons learned and the key takeaways from that, is that, again, the latest technology doesn't always work everywhere. Some of these mentor mothers, again, they sit under a tree and help other clients in the neighborhood. If they go home on the bus in the evening and we have given them, the latest tablet technology, they would have to fear for their lives. Yet, if they go with their paper pad, nothing will happen. Whereas other mothers that sit in hospitals could get more advanced technology. So you have to work locally with the local requirements. It's very, very important. And then what we also found is that it's really good to apply some of the learnings that we have in the business, like how we run accounts, how we run our business, to these type of relationships, because you cannot just rely on a single person. Somebody goes away at times and then all of the knowledge goes away with them. So similar to what we do in terms of succession planning and backup planning, we also try to sort of use what we know from how we would deal with an account, how we have feedback mechanisms, how we track the results, how often have we talked to each other, so that we basically apply knowledge and then have multiple touch points in the organization. But you've got to be well organized about it, and again, use IT as an enabler, because it gets also much more complex. But then again, this is where IT can help a lot. We also feel like diplomacy is good, and you have to really, understand how everybody works. But you got to get to a point where you have an agreement on what you want to achieve, and then you set yourself milestones, and then you hold yourself responsible to those, which I think is important as well. Very, very key at the end of the day is customer centricity. Just like it is for us, as an IT company with our customers out there, we have to know what's really important to the folks on the ground. Everything works in the local community. It doesn't just work at central, it doesn't work at any aggregates, it works in the community. We need to understand what's important for the women, we need to understand what's important for the mentor mothers, and how we can help them get those objectives done. That's very important. When it comes to metrics, I think we also need to then sort of take a look at what's the output that I want to reach, and then go back to see what metrics do I really need, because God knows we can select everything under the sun, and then what are we going to do with it? I mean, I know that because sometimes I think in my business that we run every day, what am I even going to do with some of this stuff? So we should really collect the stuff that we know will really help advance things. Where I'm really, really confident is by applying some of the latest and greatest when it comes to big data for social good. I mean, the stuff that we can now do with big data is unbelievable. It's unbelievable. We have worked in the health space. In the past, it would take 30 people to basically collect data and then analyze it, encrypt it, the security, and really get it into the proper databases. You can do it with 1 or 2 people now, because the software understands everything and puts it in the databases and does the work for you. I think we're at an inflection point. I also think I'm out of time, so I hope that this gives you an understanding of just one of the projects that we do. We do a whole lot more, and I'm looking forward to a conversation here. So thanks for listening.
So a very important point about data in relationship, right? Data in relationship to the communities we serve, data in relationship to what we want to do, to outcomes, data in relationship to how we hold people responsible and accountable, right? So what are the lessons you're learning in trying to deliver this promise of data? Where are the places you're getting stuck? What are the choices you're having to make? Let's open it for conversation. Yeah, sorry.
Gabby, do you mind? Yeah, thank you. Gabby, do you mind expanding on how do you see big data, the opportunities of big data in social impact? That'd be terrific. Thanks.
Yeah. So like I just said, one of the issues that we've had is that with these masses of data, whether it's structured or unstructured, we were not able to really, sort our way through. So a good example is what happened in the health sector in the city of Los Angeles, where they also deal with HIV-infected patients. And a lot of the information, again, from the health workers in the field was aggregated then input into the system, and then there was an humongous amount of information sitting there, and it would take forever and a day to sort through that and then to make analysis. There was nothing like real-time analysis. And now with autonomy software, for example, once you just scan it in, that's the only thing that you need to do. The software does the rest for you. So within, it's a real-time analysis of all of that input that comes from these health workers, with data analyzed and encrypted, so it's all secure as well, and basically available at your fingertips, within seconds. The same thing, is what we do then in conjunction with some of the dashboards that are available. When we, as a sort of a supporter of the programs, together with NGOs, want to have access to some of this data. In the past, again, we'd have to go to the NGO, we'd have to wait for reports and reporter. Now, I can just basically download the data myself. I don't need to trouble anybody. Much more time efficient, and much more accurate and much more secure, because you can encrypt everything, and data privacy is also is no longer an issue.
And in that is incredible power of the data and incredible intellectual property. So one of the big challenges is, whose data is it? So how have you wrestled with that question of who gets access to this?
So when we require access, it doesn't go down to the personal level. I want aggregate numbers. So for example, we've done a lot of work with the Clinton Health Access Initiative in Kenya, where we really work on the time it takes when babies are tested for HIV. It used to take 4 or 5 months for the results to come back. We installed a system so that it can be done within days, which means the children can be treated and will live a normal life. But I need to also see, how many children are we treating? What does the dashboard? All of the results that we want to have at our fingertips, basically available. In the past, we'd have to wait for a lot of reports. Now, I have it on my phone. I can download it, and I can give you the results in 2 minutes if we're interested about what's the latest status. So that makes it very, for us, very efficient. And I don't need to know the patient name. And a lot of that, again, is encrypted and is secure. And we need to make sure that only those that have access to the individual records actually have access. So I don't have that, but I don't need it either.
And how are others dealing with this challenge of the promise of data is also access to it? And proprietary data is a big topic, right? Who else is dealing with that issue? Just up front here.
So Nalini Salagram is my name, and Arogya World is the name of the organization. We're running a massive text messaging program. We've just completed it in India for diabetes prevention. First challenge was the privacy of the person, because we couldn't get the phone numbers to call them back. So it was a very difficult task to actually reach people to call them back. Second was research design itself. We did post versus pre in the people who got our messages and compared those responses to the controls for people in India who had cell phones but didn't get the messages. But we hope that we can do more analysis to confirm that indeed the 11% increase we see in daily exercise is real, because it's all self-reported. So that's the third challenge of something in mHealth, is that it's all self-reported. But we do hope that it'll add to the promise of data.
Right. And you wanted to add something?
Yes, Ann Hastings. This all sounds too good to be true. I think on the ground, there are so many problems in getting the data in a usable fashion and then integrating it. We try to get data on the poverty level of our clients when they're coming into us, and then we track those same clients over time to see what improvements in the poverty level they have. And one of the immediate problems is just, how do I get that linked in with my financial database about the loans they've received or whatever else? And it just seems to me like the technology might be there, but it's not down at the level where the people who have access to the data are really collecting it. And so we end up tracking things basically manually using Excel spreadsheets or some stupid thing, and it takes enormous amounts of time, but it's so rich and it's so valuable that you go ahead and do that because you don't see any alternatives. So if those alternatives are out, we have a big problem of dissemination because the people in the field doing the work who can get the real data don't have access to that.
Right. Just coming over here. Yeah. Thanks.
Let me just follow up a little bit with that. My name is Bob Ramsey. I come out of the emergency medical services world, and I also, my wife and I have this foundation and all that, and all over the United States. Well, in 2005, I decided that we were going to, within our state and our area, to start to put together a total technology company in terms of response time for the paramedics and that sort of thing. Just a small note. In cardiac arrest, for instance, the national average is really like 3 to 6%, and I would say that's an exaggeration. When we put together all the systems together that it was able to cause, we moved the national average from that particular percent to 30%, and in some places 50%, in a matter of a few months based upon the technology that we did. Our approach was a little bit different, and that's really what the question is. Now, we live in a different world, so we understood that data and the management of data really fell into 3 major realms. That data which was used for analytical purposes, that data which was to set up protocols, and the analysis which you've been hearing, that vast big data that you can use big data and small data. That data, that you would transform that data into a process of where we would call it retrospective, that you could react to. But we found an interesting new area in about 2007, and that's what we refer to as lifetime, real-time data for the practitioner. And we found once you measure those interventions, and that with alerts, notices, and information is that you can change things and give the data. So the challenge is how to understand what data components that you need to develop that goes into lifetime.
So there's a lot of, so you have a lot of data, right? There's lifetime data, there's reactive data, there's old data you can get. Helene, are you going to become a data company? Right? The challenge for you and all of us in the room is how much time we're actually going to spend on this, right? Because you got training programs to do, you got everything else to do. How do you make these decisions about how much to invest in all that there is?
Yeah, and kind of back to the point that you were making, I think one of the real challenges when you are an organization that has a mandate to produce outcomes, it's always a challenge to both get the resources for doing data because, again, people want to pay for helping people, making things better, whatever. So it's both the resources as well as just the reality that if you have a team that is focused on program implementation, sometimes they aren't the same people who understand the value of data. And that's why in the example that I gave, we took a lot of time to actually train our own staff in doing a lot of the data. We had outside research institutions, universities that helped us, but a lot of it was helping to train the staff so that they actually bought into the importance of data. So I think it is a big challenge, and the resourcing of it, again, collecting good data costs something. We were able to do it because we had a particular trust fund that allowed for actually doing data and doing research as part of the programming. But it's, particularly for a lot of NGOs, it's often difficult to have the resources to do that. But we make mistakes when we just keep replicating the same things over and over again and not doing the kind of research that allows you to have a greater impact. So
and that's a fine line, right? It's a fine line. Yeah. I mean, we want Ann's people not spending all their time filling out papers and Excel documents, but we also don't want to spend them too much time so they're not doing the other work. Yeah.
And I think just
Yeah.
And I think, and it's the point that Gabby made, making sure you know what you want to do with the data, because it is so seductive once you get on that
Well,
to just
sure.
start collecting data because it's interesting. But I think, figuring out up front, why do you want it? What are you going to do with it? How are you going to act upon it so that we're not just collecting reams of data because it makes us feel good?
Right. And especially given the comments from this morning's plenary that we don't even know what we want.
Right.
Right?
Yeah.
So how are we actually going to learn in that cycle? Yeah. There's a, yep, Phil.
Larswell, George Mason University. Two comments on just quickly on the input side and on the use side, both on the human-machine kind of interaction. On the cost, as I've listened to this, and I mostly attend the kind of workforce and education panels, and so I just want to sort of put out there and seek response on the notion that we have, tens of millions, hundreds of millions of youth around the world who are disproportionately able to use their mobile phones, disproportionately able to navigate digitally, and who are seeking meaningful employment opportunities. And then we have overtaxed workers, starting with NGOs doing program evaluation and so forth and so on, M&A, trying to do all this stuff themselves. And outside the door, there's kids waiting for some opportunities. And I think these are trainable opportunities. So, I'm just wondering, what's the reality check on that? Sort of deploying armies of youth to be data gatherers, data validators, and in the process, training them in 21st century skills. Like, to me, sitting here seems like a good idea, but people in the room, and also with corporates, right? And also a marker on that is Jana, which was Text Eagle, and they're doing this via mobile phone, and they have a company. And, so it's just, that's what makes me think it's not invented. But also just, I don't want to put you on the spot, Linnell, but the interaction of design and data, I know with what you've been doing, just because we were talking last night about sustainability and the context dependence of data and design processes. These are the two ends of the spectrum.
Yeah. Well, let's start with the first one, right? So what are the constraints with this proposal to get a massive amount of youth collecting data? What are the pressures on your companies, quality control, privacy of data that's a constraint on that? Anybody have a response?
How are you going to get them out to the remote locations where you're doing your work?
How do you get them out there? How do you get the youth out to those last month? That's one question. Yeah, do you have a comment on that?
Yes, I do.
Yeah.
I think you talked about the Asad Mahmoud with Deutsche Bank. I've been managing microfinance funds and other social funds for 16 years. I want to sort of talk a little bit about the experience because, what Anne said, that everything sounds so good here, but is it really meaningful and realistic? And I think the biggest mistake I have made in my career is that I bought the Kool-Aid in the initial years that anybody with a microfinance name really had the right spirit and culture. And, we collect data, but I'm not quite sure if it's meaningful, if it's the right data. And what I would sort of present to you is to focus more on the culture, or at least in my line of work, on the spirit of the people and to the governance as to how they're looking at social performance. For us, social performance and financial performance are not a duality. Ultimately, to the ideal state of social finance is a singularity where both these factors are interdependent and needed for success. So what we are focused on is sort of individualizing our social goals. We have said publicly that as one of the oldest and largest fund managers in the space, I cannot determine impact. Just like a doctor doesn't determine impact he doesn't do the research on the efficacy of the medicine. I don't have the capacity to do so. I want to be realistic. So what I focus on is to see how much attention they're paying to customer needs, how transparent they are. If they're paying attention to customer service, then the social element and the customer service element are one and the same thing. Yeah. Because who are you dealing with at the bottom of the pyramid? Their needs are very simple in terms of the Millennium Development Goal. If the microfinance institution is providing the right products, that's where the social impact comes from, not measuring retention rates. Do we want to keep all these people forever indebted? So I think the idea of this iris matrices that Jin has produced, which is nothing more than a big, thick, yellow pages, because it doesn't do anything to define anything for anybody. And I've been I'm a member of Jin from its inception, but I think we need to talk about this in realistic terms and not...
What can we measure? What does it take to measure?
How to measure it, and what is most important measurement.
Right. And it's a challenge because there's a paradox in this. The pressure to measure is what's leading some of this, and the questions that are coming up of how good a job we're doing, accountability or not. You've been waiting to say something. There's a mic coming from behind you. Yeah.
Hi, Ruth Messenger from American Jewish World Service. I think these are great observations already. I just want to add another dimension to it, and that is there's a funny word in the title of this, which is social impact. I think it makes it one of the questions is what are the changes we really want to achieve? And one of the really powerful things about CGI and the theme is that a lot of these issues, whether you're talking about education or child marriage or microfinance, we're talking basically about human rights. And we actually don't have very many ways to measure human rights. So yes, you can count some of these things, but if your goal is to sort of change the attitude toward land tenure in a country, measuring how many people actually got some piece of paper is insufficient to the big question, and I think we need to be about some of the big questions, and some of them I think are not going to have easy systems for data collection and proof.
Right. Comments? Just pass the mic down the row, Ruth.
Hi, Manuel from Mexico. I run a solar energy for rural areas company. Regarding again the social impact, if we get very strict on like statistics on like very specific, then in order to evaluate your social impact, you would need a control group. And then, so my question to the audience or to like these experiences, how do you manage this sort of control group use when, for example, with what we're doing, we don't want to have this community 2 years on kerosene, if we already know them, just to have a control group, just to get like exact and precise data for our social impact.
So what is the social manipulation that comes along with this? You want to comment on that?
Not on that specifically, but...
You're going to avoid the social manipulation topic. Somebody else want to take it up? We'll come back to you.
Sure. Yeah. In what we did, we used kind of a quasi-experimental design, so we weren't really using a randomized controlled trial, but looking at communities where the same sort of interventions weren't being done, and they weren't kept from being done, they just weren't being done, and we had enough understanding about those communities to compare them with communities where we were actually working, because we just weren't working everywhere. So it's a way of at least teasing it out without, truly keeping something from a community that might be a social good.
Well, let's come over here.
One thing that I feel like is lacking from the conversation is how are we utilizing universities? When we talk about data gathering and sort of where the expertise in that lies, experiment design, who really are the experts in this? It's universities. And I think universities suffer from not having applied knowledge. It's all theoretical, right? It lives in universities. And nonprofits suffer because we don't have that sort of rigor and expertise in our data gathering processes. And so I'm wondering, how do we make that collaboration? How do we bring more academics here to CGI to be part of this conversation?
Try for most of the projects that we run to also bring universities in. I've mentioned the Clinton Health Access Initiative in Kenya and how we work on speeding up the process of the HIV testing. All of the analytics were written by students from Strathmore University. And so, whether it's in the health space or in the education space, universities are absolutely central to a lot of the projects because, as you just said, a lot of the knowledge is sitting there.
Yeah.
And again,
gives them exposure.
Those are great examples. Who owns the data, the proprietary data between universities and businesses? Is a very complicated part of this, right? Mm-hmm. Coming from, yeah.
Hi, Ann Goddard from Child Fund. I want to comment on a few parts of the conversation. And Alex, I know you know this. It was a study done not that long ago by one of the major consulting groups that looked at how much nonprofits invested in both in finance and IT and compared them to for-profit companies. And the results were we spend a lot more on finance per dollar that we have. I think because I think our accountability and reporting to donors is tremendous, but much less on IT. We invest much less in IT. So my organization has taken that on. Our systems were weak. We had to borrow money, but we think it's that important to put in a whole new infrastructure, really for basic accountability and for getting to that goal of measuring social impact. And I'd like to go down to the other extreme.
Before you get there, how hard was that to do? How difficult were the conversations on the board? How difficult was to say we're not going to do these other programs? The direct service and other things. I mean, that's a very difficult choice.
It was a very difficult discussion with the board, but we brought them along the whole way. And
with data.
with
data.
understanding that the market required us to be more accountable to the funds. We work with hundreds of thousands of children in 30 countries around the world. We get a lot of money from a lot of individuals. We have 500,000 individual supporters. They had a high expectation for accountability. The public has a high expectation of accountability. We had to meet that. But coming up with a plan, that's hard, and one that you have faith and trust in, so it was getting the right resources in place. But then I'll bring it to the other extreme. So now every 6 months, we're counting over 500,000 children in 30 countries around the world and what's happening in their lives with their activities. We felt we had to go through 3 rounds of data collection before we felt our data was good. Why? Because there's a lot of built into the system that staff, if we really wanted this to be a learning and accountability thing, they also had to feel like they weren't going to be held penalized if things weren't right. So you really had to bring it in as a learning opportunity for everyone so they could see that was happening before we felt that everybody also understood the indicators, so you were collecting the right stuff, but that also people thought it was a learning opportunity. I like to go to the end about bringing youth in. We use youth in our program to collect a lot of the data. That doesn't necessarily reduce a lot of the cost of putting in a good infrastructure, designing it well, increasing the poor bandwidth in a lot of countries, maximizing the best you can, having handheld devices in the field so you can use it all these kind of technical things that I understand on a high level, but on an intricate level, to make it. I mean, it really is an expensive proposition for NGOs. But I do think that there's accountability out there. We have to be accountable to the public, to all our donors, that what we're doing is happening minimally, and then it's having the kind of impact that we want to have. It's a big thing for us to take on.
But it's also fundamentally, we'll come to you in a second, we're fundamentally changing the way we work with our boards and our constituencies. There is a rash of nonprofits who are doing more of this data collection and then not sharing it with their boards, because all of the story that they've told about what we're actually doing is now up.
And not only with the board, now it's also sharing with the public. Now we're going to, what we're going to be putting on our website, we got to be telling that story out there, and we got to tell it honestly, and we got to tell it to everybody. But again, we wanted to go through 3 rounds before we felt that the data was the quality data that we had. And then we have to trust that our public will accept the fact that everything isn't perfect.
Right.
That we found some mistakes.
And there's a wonderful mini case study that you had to go through 3 rounds before you were comfortable making it transparent. I mean, that's a common practice, right? Transparency is a big piece. That's right behind you is the mic.
Hi, Alexander. I'm Paul Ellingson. I work with Gabby. I think one of the things that's changing, too, that we're still stuck in this paradigm that investing in technology is a huge capital expense, and where profitable companies have, the resources to do that, NGOs are more resource constrained. They're also in more, difficult types of environments where you're having to refresh. We're now going to models, and, everyone hears about cloud computing and that. Taking a lot of that compute power and storage online is dramatically reducing the cost of your IT. Yep. You don't have those same capital expenses that also then in turn makes the accessibility of the information. And as Gabby said as well, we're looking now, instead of flying in software engineers in and doing this work on the ground, when you partner with organizations, you have students that know how to use the technology. Not only is that a more cost-effective model, it's also a more sustainable model, that you're giving real-world experience to students, but you're also creating new jobs for those students as well. Yep. So I think it's a change in the economic model, that we're not talking about big investments in technology, these capital investments, building data centers. You're using the technology that's already there. Individuals that have phones can now access this compute power that we've never seen before.
Yeah. So that's great news in sort of the reduction of input costs, right, investment costs. But at the other end, the sort of war for data analysts is getting much more higher, right? A young data analyst is going to work for which of the 2 of you, right? What are you going to pay between them, right? And so that skill set, right, is really important. Comment in the back, yeah.
So I probably come at this a little different in that I made my money in technology. So I come from technology. And so first off, I think my comment, is you guys are doing God's work. And sometimes I think people get a little too hung up on the data analysis and the technology of this stuff because of this need that you feel to be at the cutting edge. I made my money with a company that was the first to stream audio and video over the internet. That was less than 20 years ago. Apps are 5 years old. iTunes is 8 years old. My favorite technology saying is technology never goes as far as you want it to in 2 years, but it always goes further in 10. Think about what you did 10 years ago. as far as gathering data, and think about what you do today. Now think about where it will be in 10 more years. So my perspective to you all is you're doing fantastic. Don't beat yourself up about what you can or cannot gather now. The tools will be there. The one thing I know from having lived in technology for the last 25 years, it never goes backwards. So it's only going to get better. It's only going to get easier. And you guys stay focused on what you do so well in your core business.
I think that's a great idea, right? But let's be honest that it's not just about being on the cutting edge. The pressure, especially on nonprofits, to be there is from funders, right? And other people have much higher and different expectations, right? Sometimes that pressure, I'm sure, is great. And sometimes you say, let me alone. We're doing good work. We know what works, right?
But the data is only as good as what's input. And back to the realities of this stuff, we tend to get trapped in, if we hear high school graduation rates are 70%, then we lock into 70%. Gee, that must be the number. What if the data is not reliable in the first place because of how it's entered or how it's done? So we have to be realistic about it. And I am one of those donors. And I think we all have instincts about what's happening and whether it's going in the right direction or not. Data, to me, is just a way to validate what's already happening in the field.
Right. Great. Thank you. And we know some of this is much easier to validate than others. You might not say something. Yeah.
Thanks. I'm Jackie O'Neill with the Institute for Inclusive Security. We're dealing with a number of those issues as well, where our donors are getting increasingly sophisticated, and we are doing our best to stay in front of that. But it's also very challenging in part because we're an advocacy-based organization. Our goal is to get more women in peace processes around the world. And as you all know, advocacy is challenging to measure and demonstrate impact. And our commitment last year at CGI was about looking at countries that have what's called national action plans on women, peace, and security. So national strategies to get women involved in decision-making about peace and security. And right now there are about 42 of them around the world that have these plans, and they have widely varying indicators. So they have the same principles. They're doing effectively the same things, but in different ways, and then completely different ways of measuring it. So we're trying right now to develop a toolkit that has some common set of indicators where people can track things like Ruth was just mentioning, including things like perception and tracking our, not just the number of women in top decision-making positions, but is our lives becoming safer and more secure for men and women in communities. And just wanted to flag that one of the things that we're most interested is in our initiatives that relate to civil society also gathering information to hold governments accountable, because part of our initiative relies on government providing input and populating these toolkits, which many of them are interested in doing. But we also need to develop civil society's capacity to develop and start tracking indicators themselves, which is obviously a big challenge.
And a huge ask of civil society to figure out how to get the sophistication skill set to do a lot of this work. You wanted to say something, yeah.
Just a very quick, so Javier from Sugar Clinics, so we do diabetes treatment. So just talking about data, I mean, I know that there's data to measure ourselves, but also, so at the beginning we measure everything about the patient. And almost, I mean, when I say everything that times in consultations, a number of visits. So we start collecting data without knowing what to do with that data. And something that I'm very proud that we are doing now is, so a huge thing in diabetes is adherence. So when we went back to the big data that we have and say, well, can we predict when a patient is going to abandon the treatment? So now we have this great project of trying to give the doctors a tool. So when a patient comes to consultation, he has the probability of this patient to abandon and in how much time. And that allows to be proactive and have a much better care. And just following on that comment, and a question to Gabby is, so what about the wearable technologies? I mean, do you see in the short term being very involved in the work we do and collecting data much easier?
I mean, that's definitely a big trend. It's not something that we have a focus area on. Our focus area is mostly on enterprise, big time mobility, security, which are some of the big topics. There are other companies that focus more on the variability. I clearly see the trend out there where a lot more of the data is measured in real time on devices that you wear. So I'm sure this is going to be a growing sector, and we'll have to see how we play that and how we utilize that as it is basically proliferating. But for us, we focus more on the analytics.
Okay. And we'll come back.
I'm going to throw this out because I felt it yesterday and I didn't say it yesterday, but there's a big difference that we have in the room. We have some people who are social entrepreneurs. We have other people who are nonprofits. And then we might have a third category of corporate social responsibility people in big corporations. Those three categories are going to treat data very differently. And it feels to me like we keep thinking that everybody's doing the same thing, and it's not true. Social entrepreneurs often have very little that they're working with, very little capacity, very little technology, very little motivation to do all this data collection. The nonprofits do because they have to report to their donors. And then you get the corporations who have the incredible capacity to do it even in their corporate social responsibility work, But I think they're very different things going on.
True. And where does the power and where does the influence lie now, and what would have to shift? Yeah. 2 rows back, yeah.
Well, I would actually beg to differ a little bit. I'm Steve Davis. I'm the CEO of Path, and we're a large global health innovator. And I actually think the lines are blurring more and more, and I think big data will force those lines to blur where, because I think this idea that we're using data mainly just to report to funders is thinking about the problem the wrong way. We have to use data to improve our programming or get better results and drive higher impact. I think there are also 2 trends that we should be conscious of as we talk about data going forward. One is in the social sector particularly, but it's not unlike the business sector, and I too came out of technology, is that where we've been typically siloed in the way programs are funded in the nonprofit sector, whether government or foundation funding, and we collect data around evidence around those programs. Increasingly now we're being called to task, which I think is a good thing, to say, well, what's the institution-wide demonstration of impact? And that so this whole question of cross-program indicators and figuring out how we look at value across programs, not just within programs, and I think that's forcing a lot of interesting behavior change in the NGO, and it's a very hard thing to capture, but I think it's a good thing. The second thing I think is, as we look at data as it relates to global health and development, the shift from focusing on like infectious diseases and certain things that are they're not easy to measure, but a lot easier to figure out than the increasingly complicated behavioral issues that are in the NCD. And so as we see more and more people in the world and NCDs, diabetes, hypertension, et cetera, becoming a disease of the poor and doing programming in that area, that's going to get directly into lifestyle questions that when we capture data, we're really going to have to deal with privacy issues in a much different way than we have before.
Yeah. I think we do see the intersection, and part of, I think, Anne's point is also about where does the natural competencies and skills lie in those organizations. Pierre, you want to add to this?
Sure. Pierre Ferrari with Heifer International. So the way we've approached this big data issue is to try and put together a corporate-wide or company-wide theory of change and understanding what the logic is to what we're doing. And we're ending up with a consensus within the organization about what the lead indicators are. Those are the most valuable, because if you come and report with final outcomes, you've missed really what has failed. And it could be that you've said, well, the income improvement has been 70%. Why? Why is it not 90%? Why is it not 400%? So that's the direction we're taking. And so the data is actually collected very effectively by the staff now, because they are learning on how to utilize it on a daily basis. Okay, the lead indicators that are critical to the logic path that we've laid out is actually working or not working. So that's the structure we're approaching it with.
Great. So we're going to need to wrap up this conversation. We do have a tradition here of always hearing from some commitment makers before we do. You're one of them, so you'll still get your comment in. And then we'll come back to our speakers for some final thoughts. Please. Yeah.
I think I'm first. My name is Jane Wells, and I'm the founder of 3 Generations, which is a not-for-profit advocacy organization that records the stories of survivors of human rights abuses. Our commitment to CGI is to tackle sex slavery in America, and my documentary called Tricked premieres this fall, and it's the culmination of that commitment. Over the last 3 years, we followed pimps and johns, girls, parents, and law enforcement officials across the country to explore the hidden reality of the sex trade in the United States. It's our fastest growing criminal industry. It's an industry that traffics between 100 and 300,000 children per year. And globally, sex trafficking is a $32 billion a year business. Our goal was to dispel some of the myths associated with sex trafficking. One was that it doesn't happen in America. Well, it does. Another, that those who work in prostitution do so by choice and enjoy their work. It turns out they don't. That they get to keep the money they earn very rarely happens. And finally, that they are criminals. They are not. They are the victims of human rights abuses. Ending sex slavery in this country is a moral imperative. And the first step is to change the culture around prostitution in this country. That is our goal, and that was our commitment. Thank you.
May I comment on the discussion and then give my commitment? My name is Linnell Cameron with Autodesk Design Software Company. And I think what we were all talking about in that discussion was partnerships and the power of partnerships for data. And I think HP's work exemplifies that. We're not in the data business, but we are in the business of bringing data to the design environment so people can make better decisions about whatever they're designing. So the comment about the universities, we partner with the DOE, the Department of Energy, to bring weather data into the design of buildings and whole cities. We partner with a university in the UK to bring the best material database to the design environment. So people have a red, yellow, green indicator of which materials are toxic or have a high energy or carbon or water footprint. So, I think by partnering across all of our data needs, we have some incredible potential. So now for my commitment. Again, I'm Linnell Cameron, and I never thought of myself as a designer. But it is so clear to me today and here at CGI that we, all of us, are designers, people who are actively shaping the future around us. And we're not just designing buildings or cities or products. We're actually designing entire new systems and ways of living on this planet so that we can all live well and live within the limits of the planet. I am so proud to be the founding president of an up-and-coming Autodesk Foundation, which we aspire to be the first foundation that's fully focused on using design to create social impact. And so I'm thrilled to share our commitment, our CGI commitment, which is the Technology Impact Program. So we are now granting software to more than 500 nonprofit organizations who can use our software and share our vision for a better world. And we're already seeing the impact that organizations are having. Chief among them, Mass Design Group, who you may have seen on the plenary a few days ago, they are truly bringing the power of good design to the underserved communities around the world, from a hospital in Rwanda through to a cholera center in Port-au-Prince. We start from the premise that everyone deserves good design, and we are committed to doing everything we can to make good on that promise. So please help us spread the word. Tell your colleagues, friends in the nonprofit sector to visit autodesk.com/technologyimpact to join the program. Thank you.
Thank you. Closing thoughts?
Pretty much everything has been said. I guess, it's tough, it's expensive, but it's necessary.
And it will only get better.
And it'll only get better. Okay, thank you all very much.